It's our monthly segment, and joining us now is Dr. Ira Zunin. He's the medical director of Manakai o Malama Integrative Clinic. And this morning we're talking about a new study that says vitamin D can prevent the flu. Good morning, doctor, and thank you so much for joining us. Great to see us. So what does the study say, and how does vitamin D work? Well,
vitamin D is, its most important role is to maintain healthy levels of calcium and phosphorus. It helps normal bone growth, teeth, cell regulation, and it's good for the nervous system. But the study shows that it also is very important to T cells, which help us fight infection, particularly flu.
And you brought some samples in here of vitamin D. What are the samples that you brought in, and what are the different forms of vitamin D, and what does it do?
Well, these samples this is a multivitamin that has D in it, right here. Mm-hmm. This one is for people who've had some bone loss, some osteoporosis, and this one here is for people who are actually low on vitamin D. But the different types are the most important type is D3, which is normally what we'll take through supplementation, through foods, or most importantly, actually from the sun. That's converted in the body to the active form.
What's the difference between D3 and just regular vitamin D?
Regular vitamin D is actually the active form that does the job to maintain a healthy system.
And I would assume that people here in Hawaii don't have a vitamin D deficiency, because vitamin D, obviously you can get it from the sun. So are there deficiencies here in the islands?
That's the amazing thing, and that's why I wanted to talk to you about it today. That it takes about 20 minutes a day to get sun if the skin is enough vitamin D in the sun. If the skin is very light, it can take up to 3 hours in very dark skin. And we're working so hard not to get skin cancer and avoid the direct sun, use our sunblock, that many people in Hawaii are deficient in D.
Very interesting. And there's deficiencies all across the nation. Now, in terms of actually taking vitamins, how much should you take and how much should you not take?
Well, the recommendation, depending upon your age and size and need, is about 200 to 500 per day, 200 to 500 units per day, unless you're deficient. But the important thing is you can become toxic with overdose of any fat-soluble vitamins, A, D, or E. So be careful there. It's easy to test. We test many of our patients with a simple blood test and guide from there.
All right, Dr. Ira Zunin, thank you so much for joining us, and we'll see you next time. Well, sit back and relax, because we've got some music coming up. The Brothers Kaz are here. You're going to love this, Dr.